All right, welcome everyone. Today we are diving deep into one of the most common, but also one of the most critical tests we run in the lab, the urinalysis. You might think it's straightforward, but here's the thing. It all hinges on the sample, and getting that first step right, well, it's literally everything. So let me ask you this. When you think about getting a urinalysis right, what's the biggest thing that can go wrong? What's the biggest threat to getting an accurate result? Is it that super expensive analyzer we have in the lab? Maybe the reagents or, the person looking through the microscope? Believe it or not, the answer probably isn't what you think. It's not the fancy machine or even a highly trained tech. Nope, the vast majority of errors, we're talking up to 70% in some studies, happen before the sample even gets to the lab. We call this the pre-analytical phase, and that's everything from the moment the doctor orders the test, right up until it's sitting on the analyzer. This is the make or break moment where a good diagnosis is either set up for success or honestly completely missed. Okay, so here's our game plan for today. We're going to talk about why that first step is so critical. Then we'll get into choosing the right sample for the job, mastering the different ways to collect it, and what happens when you're in a race against time. We'll even cover how to read the visual clues in a sample before we finally tie it all together to see how this impacts a real patient's diagnosis. All right, let's jump right in. Section 1, the critical first step. And the subtitle says it all. Why specimen quality is non-negotiable. Look, a urinalysis is an absolute powerhouse of a diagnostic tool, but all of that power, every single bit of it, depends on the quality of that initial sample. You really don't get a second chance here. That first collection has got to be perfect. And this brings us to what I call the golden rule of urinalysis, the 2-hour rule. You have 2 hours from the time the sample is collected to the time you test it. If you can't make that window, it has to go straight into the fridge. And why is that so important? Well, think about it. Urine isn't just water. It's a perfect little incubator. It's full of nutrients that bacteria love. So if you leave it sitting out on the counter, bacteria start to multiply, cells and other components start to break down, and the sample you're testing is no longer the sample the patient gave you. The results become totally useless. Now, it's not a one-size-fits-all situation. Not all urine samples are the same. The type of sample we need depends entirely on what the doctor is trying to figure out. So let's break down the different kinds of samples you'll encounter.
First up, and by far the most common, is the random specimen, sometimes called a spot specimen. And it's exactly what it sounds like, a sample collected pretty much any time, day or night.
This is your everyday, run-of-the-mill sample for routine screening. But, and this is a big but, its main weakness is that it's just a snapshot in time. The results can be all over the place, depending on what the patient just ate, how much water they drank, or if they just came from the gym. And that is why you absolutely have to record the exact time of collection. Without that piece of info, interpreting the results is like trying to solve a puzzle with half the pieces missing. Okay, now for the MVP of screening samples. This is what we consider the gold standard, the first morning specimen. And again, the name says it all. It's the very first sample of the day, right after waking up. So why is this the ideal screening specimen?
It's pretty simple, really. It's the most concentrated. Think about it. That urine has been collecting in the bladder all night, for maybe 8 hours. So everything in it, proteins, cells, any other analytes, is packed together. This makes it so much easier to spot any subtle problems. We're talking about things like a tiny amount of protein or just a few red blood cells that you would totally miss in a weaker, more diluted sample from later in the day.
Now for some really specific questions, we need different tools. A 24-hour or timed specimen is what we use when we need to measure the exact amount of something. Some substances in our body change levels throughout the day. That's called diurnal variation. So we collect everything for 24 hours to get a total average. Then you have the midstream clean catch. This is the go-to for bacterial cultures. Why? Because the whole point of the technique is to avoid contamination, so we can be sure that any bacteria we find are actually coming from inside the bladder, not just from the skin. Okay, so we've picked the right kind of sample. Now we get to the hands-on part, actually collecting it. And I want to be really clear here. This isn't just about handing someone a cup. It's a real skill, and how well it's done has a direct, massive impact on the results. So let's walk through the midstream clean catch method, step by step. The whole goal here is to avoid contamination. First, you've got to wash your hands. Then, cleanse the genital area. For females, this is always front to back. Next, the patient starts urinating, but into the toilet. That first part of the stream, its job is to flush out any bacteria hanging around at the opening of the urethra. Then, they collect the middle part of the stream in the sterile cup. And finally, the last bit goes into the toilet. This whole process ensures the sample we're testing is the cleanest possible reflection of what's actually inside the bladder. Of course, sometimes a patient simply can't provide a sample on their own. In those cases, we might use a catheterized collection, where a sterile tube is inserted right into the bladder to get the sample. And if we need the absolute most sterile sample you can possibly get, say for a newborn baby or for very specific types of cultures, we can do what's called a suprapubic aspiration. This is where a doctor uses a sterile needle to go directly through the abdomen into the bladder to pull urine out. It's invasive, but it guarantees a perfectly sterile sample. Okay, remember that 2-hour rule we talked about? Well, now we're going to look at what happens when you ignore it. The moment that sample is collected, a clock starts ticking. Leaving it out at room temperature means the sample starts to fall apart almost immediately. It is truly a race against time. So, what exactly goes wrong? Let's break it down. Physically, the color can change and it can get cloudy as bacteria grow. Chemically, oh boy, those bacteria start eating any glucose in the urine, so you might get a false negative for glucose. They also turn urea into ammonia, which makes the pH go up. It becomes more alkaline. That higher pH can literally destroy red blood cells, white blood cells, and casts. They just fall apart. At the same time, things like bilirubin break down just from being exposed to light. So the bottom line is, a sample that's been sitting out for a few hours is a completely different chemical soup than what the patient actually gave you. All right, on to our next section, reading the visual clues. Before we even touch a reagent strip or fire up the microscope, the very first part of a urinalysis is just looking at the sample. The color and the clarity are the first clues we get, and they can tell us a lot. So what actually gives urine its yellow color? Well, the main player is a pigment called urochrome. The more urochrome, the more concentrated and darker yellow the urine is. But there are a couple of others too. Urobilin is an orange-brown pigment that comes from old red blood cells, and uroerythrin is a pinkish one that sometimes shows up and can coat crystals that form in the sample. But things get really interesting when we see abnormal colors. Each one tells a potential story. Pale yellow could mean someone's drinking a ton of water, or could be a sign of diabetes. Dark yellow or amber could just be dehydration, but it might also be bilirubin from liver issues. Pink or red is a big one. It could be blood for sure, but don't forget it could also just be from eating beets. Brown or black can be a sign of old blood, while green or blue-green might mean a Pseudomonas infection, or that the patient had asparagus for lunch. You have to consider everything. Okay, after color, we look at clarity. And that's really just a fancy word for how clear or cloudy the sample is. It's a spectrum, from crystal clear all the way to something that looks like milk. We usually describe clarity with terms like clear, slightly cloudy, or hazy, cloudy, and turbid. Now, this is super important. Cloudy doesn't always mean bad. Sometimes, if you pop a urine sample in the fridge, normal crystals will form and make it look cloudy. That's harmless. But cloudiness can also be a huge red flag. It could mean there are white blood cells, bacteria, or yeast in there, which is a classic sign of an infection. Okay, let's put all the pieces together now. We've talked about collection, timing, and storage. But how does this all play out in the real world? How does pre-analytical care actually impact a patient's diagnosis? This is the perfect example. Let's imagine we have one perfectly healthy patient, but 2 samples. Sample A is handled correctly, tested right away. The results? All negative, no sign of infection. Now look at sample B. It's the exact same urine, but it was left sitting on the counter for 4 hours. The few harmless bacteria that were on the skin multiplied like crazy. They started converting nitrates to nitrites, and suddenly the test comes back positive for infection. This could lead to a totally wrong diagnosis and a prescription for antibiotics the patient doesn't even need, all because of a simple mistake in handling. So, what's the big takeaway from all this? It really boils down to one simple, powerful truth. The most advanced analysis is worthless if the sample is wrong. You can have the most expensive, state-of-the-art analyzer in the world, but it means nothing if you feed it a bad sample. Accuracy doesn't start in the lab. It starts with the patient, with the collection process, with that race against time. Getting that pre-analytical part right, that is the absolute bedrock of every single accurate diagnosis we make.